It's Margaret Young. I'm a trainee advanced nurse practitioner for the urgent response team at CARES.
And I'm Laura Wilson. I'm also a trainee advanced nurse practitioner and I'm the team manager for the urgent response team for the community addiction recovery services. So the team consists of 3 trainee advanced nurse practitioners and 3 peer support workers. So we came live in March. We were initially we were employed by South, but we've took a Pan-Lanarkshire approach. So we're covering North as well. So Pan-Lanarkshire, we have another 2 trainee advanced nurse practitioners who are going to be coming on board. And as I say, we've got 3 peer support workers who are going to provide a wraparound service for any patients that's open to us and trying to get them engaged into community recovery. So there are national standards and every locality throughout Scotland needs to have MAT standards implemented. But we're going to be the first service that is going to offer 7-day service. Normal addiction services are Monday to Friday 9 to 5, whereas we're going to be working out of hours and at weekends as well, so that because it's about a window opportunity and getting people started in treatment there, so we need to ensure that our addiction doesn't stop at 5 o'clock. Just now what happens is any referrals that go into the locality teams, I think there's 6 locality teams in North and 4 locality teams in South. The referrals are screened on a daily basis and then they're passed over to us. And then we pick them up. We normally do a telephone assessment on the patient first and obviously get through their addiction issues and their kind of health and social issues as well, and then we discuss treatments with them so that they can make an informed choice, and then we arrange to go out and see them, either see them in a health centre or we essentially reach them at their home.
I mean, we've already kind of checked their health history and things on the system, so we know quite a wee bit about them before we speak to them, and we do the full telephone conversation, so we do have a kind of feel for the person. But when you're going down at that time, it's more about just continually reassuring them that it's okay to refer in. It's a positive thing that we've done. A lot of people are still really nervous when they're coming in and they feel quite judged and stigmatised. So it's kind of more about reassuring them that that's not the case. We're here to support them. There's no judgment. It's more about trying to keep them in treatment, make sure they get that support. So we're there, we basically just do a set of clinical observations. Part of the process is that you do need to get a positive urine screen, so we need to get a urine sample and dip that. But before we've seen them, we've already discussed their medication, explained the options. So for us it's buprenorphine and methadone. Explained about them and the patient has a choice. So give them as much information about that, and it really is kind of up to them. If they did pick a medication and think it's not really for you, we'd try and kind of explain why, but it's still ultimately their choice. So we've got the prescription already. We've already arranged their chemist before we meet them. It's all done beforehand. Obviously family are there as well. Not everyone has family there, but if they do, it's about trying to support them as well. A lot of families are stressed. We're talking about patients that have had probably non-fatal overdoses in the past as well. And the family have tried everything to try and change that. So it's about offering them support, letting them know how they can support their relative, letting them know we're here. Obviously there's confidentiality involved, so let them know that sometimes we can't discuss the patient's treatment unless they've given consent, but we can support them and take on board their concerns, and then maybe we can discuss that with the patient as well.
We've also got good links as well to commission services within the community, and we can link families in, so there's My Support Day, so we're trying to link families in with that, and we're trying to obviously link patients in with community recovery as well. A big part as well when we go out to see the patient is we do a lot of harm reduction work, because they're trying to eradicate Hep C as well, so we do bloodborne virus testing when we're out, and we provide the service user with naloxone, which is a drug that reverses the effects of opioids. So we do all that when we go to see them. So far we have had 230 referrals since the beginning of March, and everybody that's been suitable has been started on same-day access to treatment. So we've had really positive feedback, verbal feedback, but part of the peers' roles as well is that they will be gathering experiential feedback, and that will be getting submitted to the Scottish Government as well, along with the data that we gather about who's all been able to access same-day treatment. So all three nurses that are on the team and the two new staff who are coming on board were all independent and supplementary prescribers. So we can start the person on medication that day and then we put them in for an appointment with the medical team after that.